Welcome to Supporting Youth Empowerment through Shared Decision Making, part of the Pathways Transition Video Brief series. In this Pathways Transition Training Video Brief, Dr. Ajit Jetmalani, Director of Child and Adolescent Psychiatry at Oregon Health and Science University, shares strategies for supporting youth empowerment through shared decision making in mental health care. Dr. Jetmalani recommends considering a broad array of options in healthcare decisions, consulting with youth about treatment choices, and disentangling youth autonomy and best interests in order to assure that there is informed consent in shared decision making.
When youth face challenges of a mental health nature, they likely have challenges based on a wide array of issues, from genetic to environmental to social. There might be academic issues. There might be relational struggles with family or friends. There may be poverty. It may be that they're experiencing bullying at school. There's a whole host of reasons that people end up needing mental health care, particularly in adolescence, when most mental health conditions present in this age group. And the key to positive outcomes is looking at a broad array of options, but that broad array of options is based on an understanding what the underlying struggles are. One of the dynamics is about autonomy and the capacity to be making choices for oneself. We, from a societal point of view, have given the indication that, well, now you're an adolescent or a young adult, you should be able to make your own choices. When it comes to healthcare, the dynamics can get a bit confusing. People can choose to assert their right to make choices by saying no. I don't want to go to the doctor, or I'm not going to take that medicine. Not because there's a healthcare choice being made, but because they're desiring autonomy and a capacity to assert their rights. And you want to help that young person disentangle their healthcare choice from their sense of desire to have autonomy. In other words, finding a way to support their desire to be autonomous in making the choice to seek support from a healthcare provider. It's a process that involves having a respectful approach, acknowledging the person's desire, and then having them think through, what is really in their best interest, as opposed to how could they best assert their right to be in control of their life. And you want that person to feel empowered to participate in that healthcare decision making. In order for people to feel empowered and effective, they need to have enough information to know how to approach that circumstance. So when youth approach a healthcare appointment, one way to support them is to practice before they attend that appointment. How are they going to use the time? And maybe even take in materials to remind themselves in exactly what it is that they want to get out of that meeting. And if they already know that this could be a meeting about the use of psychiatric medicines, what are good questions to ask the provider in a manner that is collaborative? So you want to set that person up for success. When they go to their appointment, they need to be consuming that moment of healthcare in a successful fashion. That involves knowledge, and it also involves communication strategies. So how do I ask a question of a health provider that's going to get me the most information without making them feel like I'm really just questioning whether they have my best interest in mind? So I think one of the key things is that sense of empowerment, because that's what all of us are looking for in our lives, is a sense of empowerment, capacity to be assertive and have some sense of effect in the outcome. And for youth, particularly youth who are distressed, who may be coming from traumatic backgrounds, the last thing they feel is empowerment. Really what we want to do is help youth feel that they are well prepared to participate in their own health care and understand why is this being recommended. Where might medicines and medical treatment play a role in supporting their success in meeting the challenges that they face. And thinking about, well, what are the consequences to making that choice or not making that choice to take a medicine? The medicines that we have can have great benefits and they have risks, And we want to understand both benefit, risks, and the alternatives, and then make a decision together with our healthcare provider, another trusted adult perhaps, a parent or a caregiver, and putting that information together to make a decision that's informed. You know, one of the things about accessing care, especially when this is a new experience, is that you really want the young person to feel that they are participating in that very decision about seeking services. And you know, the term I think that reflects the process best is motivational interviewing. It's really the ability to engage in a conversation that builds the reasoning behind which you would choose to seek health care. So as you're interviewing a youth and talking about, well, it sounds like you've really been struggling with your mood being really poor, and you've been feeling really sad and depressed for quite a while now. And what have you tried to improve that? And have the youth talk about, well, what have they tried? What's been working? What hasn't been working? And then reach a conclusion with them. If it sounds like they've been trying, they haven't succeeded, they're not finding that they have any other solutions, maybe this would be the time to ask for more help, some more expertise, to see if they have some ideas about what we might do.
Discussion questions and resources on youth empowerment and shared decision-making can be found through the link on this slide. A live link can be found on the YouTube channel description of this video brief. We'd like to acknowledge support from the National Institute of Disability, Independent Living, and Rehabilitation Research and the Center for Mental Health Services, Substance Abuse, and Mental Health Services Administration.